Today I've got a brief overview of rib pain, why we experience this, um, the anatomy around it, where we need to direct interventions if you are dealing with pain. And then Thursday, for Therapy Thursday this week, we're going to actually walk through exercises and mobilizations for this joint. But we need to have a good understanding of what we're even targeting before going into the exercise component. So I just have a couple of pictures. Here's a rib cage from the back of somebody. So you can see their skull, you can see their vertebra, so that's just their spine, and then that connects to ribs. And then you have your shoulder blade, your scapula, just kind of sitting on top of the ribs. So what we really want to look at is the rib cage. So you've got lots of ribs. Some of them are connected to the sternum. So this is from the front. That big bone kind of right there is your sternum. And you can see there's like white next to it. That's like cartilage. So the rib cage should be a little bit bouncy. We don't want it to immediately break if something were to happen. It's there to protect your vital organs, your heart, your lungs, and other stuff. So a little bit of a bounce is normal. If you look at the bottom of these, we have some are true ribs, some are false ribs. And then as we get to the bottom two, these are actually floating ribs, meaning they're not actually connected to that cartilage. They're just kind of around the backside. And then the other reason I pulled this picture up is for you to see how many muscles are around it. It's one of those things that I didn't realize how many you had until I was in PG school and actually like dissecting. There are so many layers of intercostal muscles, in addition to your deep core muscles, your obliques, and the muscles that might be a little bit more well known. And, we're not gonna you don't have to memorize all the muscles, but knowing that there are a lot of layers can explain maybe why when it's aggravated it hurts so bad. With all these muscles, we also have some nice bundles of nerves, and that can also contribute to more pain. So when you get rib pain, it's like that take your breath away pain. And a lot of that's because the rib cage does move with your breath. And so every breath, I mean, it hurts. And a lot of times, a lot of rib injuries would be like maybe breaking a rib. But in the hypermobile population, we get more sprains um, and aggravation of the joint itself. So we're going to look back at this slide. You're going to look at the spine, and right where that spine connects with a rib on either side, that's often our culprit, is the joint getting aggravated for whatever reason, whether it's you strained it, there's too much movement happening there because ligaments are what connects bone to bone. So there's just ligaments and cartilage there. So when you are more lax in ligaments and cartilage, you're more likely to overload the joint for whatever reason. Because of this attachment, when we are talking about exercises for rib pain, the rib itself is just kind of a protection. So what we really need to address is the spine. And so specifically that thoracic spine that has more rib attachment. So that's that upper back to mid back area that we need to address and to mobilize. So sometimes that thoracic spine gets locked up and the ribs also take some of the load. If we can mobilize the spine, your ribs should feel a little better. There are some rib mobilizations you can do as well, but most of the research on this shows you can address the spine and that will help with your pain. So on Thursday, what we're going to talk about is how to actually mobilize this little joint where your spine connects to your rib. And then we're going to also go through some thoracic mobilization exercises. Let me see if there's anything else I wanted to talk about. I think that's a good brief overview. Um, yeah, we'll talk about the mobilizations. I think that will help kind of solidify what we talked about. But just know there's a lot of ribs, there's a lot of cartilage and connecting and ligaments connecting bone to bone. And you can get little sprains or strains. We can address the rib, but we're going to get more benefit if we can address the spine where it connects. And your breath, it might be that sharp pain or kind of a grabbing, take your breath away kind of pain. So we need to make sure we are mobilizing the rib cage so that it doesn't get stuck. So sometimes we got too much movement and then we strain it and it gets stuck. So it's finding that balance between you're going to have more movement, but also the stability component. So comment if you have any specific questions, and we will go through the exercises on Thursday.